CA person. Thanks very much all for coming. I'll leave you with Fran.
Okay. Right. Good afternoon, everybody. Welcome to my talk on health and safety, which covers Section 2, Module 2 of the IBMS registration portfolio. My name is Fran. I am the training lead over at Wythenshawe Hospital in the histopathology department. Okay. So I will start now. So the registration portfolio learning outcomes are to understand the need to maintain the safety of themselves and service users, awareness of the applicable health and safety legislation, awareness of the applicable health and safety policies and procedures, and to understand the biological hazard groups and associated containment levels. So as with all modules of the IBMS registration portfolio, these are the learning outcomes that your coursework must cover. So basically setting up and maintaining a safe working environment, keeping yourselves and your work colleagues safe, understanding why we have the health and safety legislation, policies and procedures, and understanding the biological hazard groups and the containment levels. Okay. So I've put some learning objectives up. So these are the things that I think should cover the health and safety. So we've got looking at the importance of health and safety, obviously the legislation, because there is quite a lot of it, recognising some of the safety signs, why health and safety is important in a laboratory environment, looking at some pathogens. I've done a little bit about manual handling. I've only covered certain things very briefly because it just gives you an idea what you can put into your portfolio evidence. Some chemicals and reagents, a little bit about incident reporting, and I've put I want to cover COSH and risk assessments because they're things that come up quite a lot in interview questions, and from past experience a lot of the candidates don't seem to know much about COSH, so I just want to go into a little bit more detail. Okay. So what is health and safety? So it's basically self-explanatory. It's a series of regulations and procedures which are intended to prevent accidents or injuries within the workplace. And there's quite a lot of legislation that covers health and safety. So I'm going to briefly go through all of them now. So there's the Health and Safety at Work Act 1974. This is the main legislation which covers occupational health and safety in the UK. It also outlines the responsibilities of everyone for maintaining health and safety, and the everyone includes managers, employers, employees, and owners of businesses. Sorry, just bear with me. Oops. There's also the PPE at Work Regulations 1992. Sorry, just let me move this over a little bit. Do apologise. Sorry, the PPE at Work Regulations 1992, these were created from the Health and Safety at Work Act. Basically, the employer is liable to ensure that employees have suitable PPE if they have been exposed to a risk in the workplace. The provision and use of work equipment regulations, otherwise known as PUA, these make the workplace safer for employees using who are using or are in contact with the equipment. These includes everybody who needs to access the equipment. It ensures that the equipment is kept in good working order and is regularly maintained and inspected to sufficient levels to ensure that it can be used for your routine jobs. So then there's the lifting operations and lifting equipment regulations, which ensure that companies who own, operate, or have control over lifting equipment must be responsible for the safety of the operators. The lifting equipment must be managed and controlled to avoid injury or damages. There's also the work at height regulations, which were introduced to prevent death and injury caused by falls from height. And then we've got the manual handling operation regulations 1992. So these are obviously involved in what we do in the lab as well, because we provide manual handling training to all our employees. So these regs are to avoid handling activities involving risk of injury. It encourages people to make assessments of manual handling risks and to try and to reduce the risk of injury. The assessment should consider the task, the load, and the individual's personal characteristics, such as the physical strength, and provide workers with information on the weight of each load. So I'll talk a little bit about that later. There's the management of health and safety at work regs. These were put in place to ensure that the employer's main duties were fulfilled. These include assessing health and safety of the workforce and acting upon risks, appointing competent people to oversee the workplace health and safety as well. Workplace regulations were introduced to ensure that employers provide adequate lighting, heating, ventilation, workspace, providing staff facilities such as toilets and tea rooms, and safe, clear passageways through the working environment. And this all obviously helps with the health and well-being of the workers and ensuring that they get adequate breaks as well. The display screen equipment regulations cover people who frequently use display screen equipment. It covers risk assessments, taking adequate breaks, provision of health and safety information, and also the employer is liable to provide regular eye tests for people who use a lot of display screen equipment. They also need to provide adjustable furniture and demonstrate that there are procedures to reduce the risks associated with sitting at a display screen frequently. Then we've got RIDDOR. So under these regulations, employers are required to report a wide range of work-related incidents, injuries and diseases to the Health and Safety Executive or to the nearest local authority environmental health department. The regulations require an employer to record in an accident book the date, the time, and the incident, along with details of who was affected, the nature of the injury, any condition as a result of the injury, their occupation, the place where the incident happened, and a brief note on what actually happened. Then we've got the Working Time Regulations 1998. So these regulations implement 2 European Union directives on the organisation of working time and the employment of young workers under 18 years of age. They cover the right to the employees to have annual leave and to have rest breaks, and they also limit the length of the working week. So these include things like working a maximum of 48 hours each week. Employers have a contractual obligation not to make employees work more than 48 hours unless the worker has opted out of this voluntarily and it's been put in writing. There should be minimum daily rest periods unless shift working arrangements have been made that comply with the regulations. And there should be an uninterrupted 20-minute daily rest break after 6 hours work to be taken during rather than at the start or the end of the working time. So then we've just got some employer health and safety basics. So these are things like providing a safe place to work, making sure that the working environment is safe, there are facilities for staff, provision of correct PPE and equipment to do the job. They should provide a health and safety policy that must be followed, by all staff. They need to prevent risks to health by carrying out risk assessments, ensure that equipment is PAT tested and maintained and serviced so that there's no risk of injury or harm. They must ensure that all staff are trained in all procedures and supervised where possible. And that includes, if there's any changes, they need to make sure that the staff are informed, whether that's retraining, just sending out memos, but just making sure that the staff are kept up to date as well. Ensuring that materials are handled, stored and disposed of properly and correctly. There should be adequate first aid measures, and there should be a good incident reporting procedure in place for injuries, diseases and dangerous occurrences. The employees must ensure, obviously, that they don't put themselves and others at risk. And the employers need to make sure, obviously, that the employers are following the policies. There should be also some air monitoring as well, which is quite important, especially in the labs, especially in histology, because of some of the chemicals that we use. So employee health and safety basics. So like I've already mentioned, employees must ensure that they don't put themselves and others at risk. They must take care of their own health and safety and well-being. If they're not fit for the job because they're not feeling well, they should, do things like alert the manager or ask to be taken off a particular task if they know that they're going to be affected. Following the health and safety policies, reporting any incidents or injuries, wearing any PPE that's provided to keep them safe. So that's things like goggles, lab coats, plastic sleeves, using fume hoods, wearing aprons, and also wearing closed-toe shoes and keeping your hair tied back, because this is important. It's quite easily done. If you're pouring, for example, an acid out in a fume hood, you can sometimes get splashes. It doesn't matter how careful you're being. So it just protects yourself. They must also report any broken equipment and ensure that they only use equipment if they've been trained and signed off as competent in its use. So working in the lab, most staff need to be vaccinated if they're working in any kind of lab. Most of the time, all of the labs I've worked in the NHS, I've had an appointment with occupational health, and they've gone through my immunisations with me. The ones that they tend to look at most are BCG, which is immunisation against tuberculosis, hepatitis B, and a lot of trusts now, although it's not compulsory, a lot of trusts do offer influenza and COVID jabs each winter, just to protect the staff, and obviously within the hospital environment to protect the patients. So hepatitis B tend to be recommended for staff who are in direct contact with blood, body fluids or fresh human tissue. After the initial course of vaccination has been administered, they should do antibody titers, which are checked 1 to 4 months after the completion of the primary course of the vaccine. This is just to make sure that the antibody levels within your body are sufficient. Otherwise, the individual may need a booster jab. Like I've said, these are the basic ones, but depending on what lab you work in and what type of organisms you're working with, there are other ones. So there's also Hep A, Japanese encephalitis, cholera, meningococcal, smallpox, typhoid, yellow fever and varicella, but they tend to be for people who are working in specialist labs with really contagious pathogens. So I've just put a couple of pictures up of different types of PPE. Obviously we've got lab PPE, but there's also other things like construction vests, high-vis vests, protective boots, gloves, hard hats, and safety glasses. And the reason I've put these up as well as obviously the lab coats, gloves, clothes, shoes, safety glasses, is because you do see personnel around the hospital who are wearing these types of clothing. So it's just to point out that it's not just within the lab that we wear PPE, it is in the main hospital environment as well. So COSH. COSH is control of substances hazardous to health. And we do COSH assessments on every chemical and reagent in the lab. The data for the COSH assessments comes from material safety data sheets which come with the chemicals. And these tend to be put onto our quality management system. What we use at MFT is one called QPulse, and I think a lot of trusts use that one as well. So what information do COSH assessments contain? And again, as I've already mentioned, I'm going into detail a little bit more in this because it is quite a common interview question, and the answers are never really very good with them. So this is an example of a COSH assessment. It's a detailed document, and as I've mentioned, it takes its info from the MSDS sheets that come with the reagents. So it contains things like the name of the substance, what it's actually used for, the suppliers in case there's an incident and we need to get in touch with them, which staff groups are going to be using the chemical, the concentrations and other chemicals of the reagent. Sometimes, like for example with formalin, which is what I'm discussing here, it may contain small amounts of methanol as well. So it just lists any other things that it may be present as well, because obviously they've got their own problems and risks. It also states the amount that is being used, how long it is being used for, and the amount of exposure. So we've got something called the WEL, which is the workplace exposure limits. So there's a long-term exposure limit and a short-term one as well. It also lists different hazard symbols. So this one is about formalin. So it's saying it's an oxidizing reagent, it's potentially explosive, it's highly flammable, it's toxic, it's harmful, corrosive, it's a serious health hazard, and it's dangerous for the environment. So these are the list of hazards that we can select from. So in this case, it's a serious health hazard, it's toxic, and it's also a category 2 mutagen and a category 1B carcinogen. I'll go into the different types of carcinogen a bit later on. The COSH form also states different names for chemicals. So for example, if it was like isopropanol, it's also known as propantuol. So it can include different things like that. There's also how to store the chemical, instructions in case of injury or incidents, and also emergency controls, disposal instructions, and which PPE should be used. So there is quite a lot that goes into a COSH assessment. The next thing we're going to look at is hazards and risks. So what is the difference between a hazard and a risk? So a hazard is anything which can potentially cause harm. Hazards can be categorized as chemical, mechanical, electrical, or biological. And a risk is the probability or likelihood of a hazard causing harm from exposure to the hazard. So risk assessments. there are a number of reasons why risk assessments are important in the workplace. Firstly, they're a legal requirement, and then I'm also going to outline some of the main reasons now. So they're crucial to preventing accidents in the workplace. They don't just reduce the likelihood of accidents, they also help raise awareness of hazards and minimise risks. So obviously we do risk assessments on things that are going to potentially cause accidents. So by alerting your staff to the risk assessments, it's also alerting them to take more care when they're doing that task. They reduce injuries and save lives. So risk assessments don't just identify hazards that create short-term risks. Without effective risk assessments, long-term risks as well, such as exposure to asbestos, for example, wouldn't be identified or mitigated, and potentially leading to fatal health problems. So that's just, it's all right if you're dealing with asbestos in the short term, but if you're repeatedly dealing with it in short bursts, it'll build up, and it's the long-term effects which you're going to see years later. So it also helps to identify things like that. They generate awareness about hazards in the workplace. So organisations and employers being aware of hazards means injury is less likely to occur. It doesn't just keep everyone safe and well, but it also helps the company to save money, because obviously injured employees are going to require time off, sick pay, potential compensation, and they could be fined if they were found to be in breach of the law as well. So it can be quite a big thing for a business if they're not following the health and safety policies and they haven't done the risk assessments. They also help managers who make decisions about risk. Make appropriate adjustments. So having an effective and formal risk assessment in place demonstrates that you've taken appropriate measures to ensure the health and safety of the employees. So what may happen in some cases, you do a risk assessment. Unfortunately, an employee will have an accident, and then the managers will reassess that risk, and then they'll put up further measures in place to try and minimise it happening again. It doesn't 100% stop it, but it does reduce it. So it's always best to reassess. There are different types of risk assessment. So there are fire, manual handling, display screen equipment, and also COSH, which we've just looked at. So this is just an idea, an example of a risk assessment which has been done in the lab. Okay. So how to do a risk assessment. So the HSC, the Health and Safety Executive, has recommended a 5-step process for completing risk assessments. Firstly, it's important to identify any potential hazards within a workplace that may cause harm to anyone that comes into contact with them. Then they need to identify who may be harmed by potential hazards. You need to note down who could be affected and whether it is going to be through direct contact or indirect contact. After identifying any hazards and who might be affected, it's then important to evaluate the severity of the risk and the severity that it may present or should it occur, and also to establish suitable and effective controls to reduce the level of risk as far as is reasonably practicable. Fourthly, if a workplace has 5 or more individuals, significant findings of the risk assessment are required to be kept either electronically or in writing. Recording findings on a risk assessment form is just an easy way to keep track of the risks and control measures which are put in place to reduce the identified risk. The form tends to include what hazards were found, the person or groups affected, controls which have been put in place to manage the risks and who is monitoring them, who carried out the assessment, the date the assessment was done, and lastly, employers should periodically review the assessment process and, if necessary, reassess any controls that are in place. A good guide to when you may need to review your processes are if there's been a significant change within the workplace or any processes in question, if there has been an accident or ill health reported because of an incident at work, and if there's any near misses that have been reported as well. So it's always a good idea then, because it's, you've got to make sure that you're covering everything and making sure it's not happening again. So just going to talk a little bit about manual handling now. So manual handling is any transporting or supporting of a load, including the lifting, putting down, pushing, pulling, carrying or moving thereof by hand or by bodily force. And this goes back to the regulations which you mentioned earlier on, which were the manual handling ones, which were 1992. So every trust will do some kinds of manual handling training with its staff. And this is because back and musculoskeletal disorders are one of the main causes of sickness and staff absence. So we've got something called Tilio that we use with manual handling. And it's just like an assessment of what you've got in front of you. So if you're asked to move a load, this is where Tilio comes in. So the T is the task. So you need to look at specific forces or movements during the procedure. So what are you required to move? Is it a small box? Is it a big load that needs a trolley? Just consider things such as those. Individual. So look at the skill, the experience of the individual, the capability and characteristics. So if you're gonna, this is looking at things like if you're gonna ask someone to move a huge heavy box, it's pointless asking a little svelte female, for example. And I don't mean that to sound, I'm not trying to be sexist, but I'm just trying to use it as an example. You need someone who would be able to lift that, potentially move or lift that that box, or be able to transport it effectively. Then you look at the load itself. Is it an object or is it a person being moved? Look at the environment. Are you moving it down a corridor, for example? Is the corridor full of boxes? Is there any obstacles in the way? Is it clear? Are you having to move it through doors, like tight spaces? So it's worth looking at the environment in advance so you can plan how you're going to move your load as well. And then also other, so that's just looking at whether you need any equipment, handling aids, and looking at the actual workload. So by taking into account Tilio, it helps you put a little plan into place to move the load effectively, so you're not causing damage or injury to yourself and to your spine. I've only just touched on this because obviously it's important, but I don't want to go into great detail because, as I said, all the trusts do their own manual handling training, and that can either come in as separate training or it can be part of mandatory training as well. So also spillage training is another big one. So in histology, where I work, for example, formalin is one of the major chemicals which is involved in spillages. So different labs use different chemicals which can be mutagenic or carcinogenic. So formalin is used in histology to fix all our specimens. Obviously there are a couple like in cytology which require different fixatives, but the majority of histology specimens are fixed in formalin. It's not a nice chemical. If there's a spillage, we've got to look at different levels of spillage. So it's up to 100 mils. That's fine, as long as it's contained. You can pour it onto a downdraft bench, clean it up with blue roll. You may need a few spillage granules, but it's easy to contain. It's easy to dispose of in a sealed yellow clinny waste bag. The next one is the larger spillages. So you've got over 100 mils, so they go from 100 to 500, sorry, 100 to 5 litres. So if you had a spillage, in that case, you'd have to evacuate the area. You'd have to put on a respirator and use the spillage granules. You could not allow people back into that area for maybe a couple of hours until all the fumes are dissipated. In a lab where you've got windows, it's great because you can open your windows. At Wythenshawe, we haven't got windows where our cut-up dissection is, so we have to make sure all the room is sealed and make sure all the ventilation through the downdraft benches, and open the vent into the next room and make sure that's been sealed off, but all the downdraft benches are working properly to try and take all the fumes out. We also have like big sausages that we can put at the bottom of the door to make sure any of the fumes don't come out, and the person dealing with it has to put the respirator on, and then they can go in after a while and measure the formalin fumes in the atmosphere. There are different ways of measuring the fumes. So we've got an electronic meter, which we call as elder meter. So that'll measure the fumes in the air. The other ways of doing it as well, you can also get little badges, but you have to wear them for a couple of hours and you can't get immediate results. You have to send them off for analysis. And there's like a manual one as well that uses like a cartridge and a tube, but they're quite fiddly to use. So there are different ways of doing it. Biochemistry, obviously I'm not a biochemist, but I did ask one of the trainers in biochemistry, were there any specific chemicals, because I know some of you may be biochemists. So I do apologise if I've got this wrong to any biochemists, so feel free to correct me. But one of the things I was told was methyl terbutyl ether, dichloromethane and hexane, which are all used to extract androgens and vitamin B and D from specimens. These are all quite dangerous and will require specific training. I was told as well that, for example, with the methyl terbutyl ether, if there was a spillage of that, the lab would have to be evacuated. I was told that it's used in a fume hood, and they have electronic pipettes as well to make sure the risk of spillage is minimal, rather than using like the manual pipettes. So looking at some carcinogens. So carcinogens are classified as group 1 to 4. So I mentioned before formalin was a carcinogen, and I know just going to go back, the methyl terbutyl ether is also a carcinogen as well. So group 1 carcinogens, they are carcinogenic to humans, there's no doubt about it. Then we have group 2A, which are probably carcinogenic. Then group 2B, which are possibly carcinogenic. Group 3 are not as classifiable as there to be in any carcinogenicity. And group 4, they're no risk. They're probably not a risk to humans. So most chemicals, if they are carcinogenic, will be grouped into one of those 4. Incident reporting, that's another big thing with health and safety. So incident management is basically the process of capturing, recording and managing the occurrence of injuries, damage or incidents. It documents all of the facts relating to incidents in the workplace, And it's also important because it allows employers to properly investigate the incident and put measures in place to prevent it happening again. So there are all different ways of reporting incidents. Different trusts have different systems. So here at MFT, we have one called Ulysses. The last trust I worked in had one that was called Datix, but they're all basically the same. You log on and you have like a series of questions from drop-down menus, and you have to just fill them in as best you can. And it'll look at who was involved, whether it was a patient or a member of staff, who was responsible, whether it was your department, whether it was another department. That could be things like it could be a specimens spilt in a transport bag, and it could be because someone in another department has not put the lid on properly. So it's documenting where it's occurred, because obviously at the end of it, a report will go out to different managers, and then they'll have to obviously work with their staff to make sure that they get extra training or they are made aware of what's happened, you know. So it'll also document who was involved, when it happened, any measures that were put in place at the time to mitigate it. And as I said, at the end of it, once you filled it in, it's submitted, it's sent to the incident management team, and they will forward reports to the different managers, who will then feed back to the staff. Another thing I've put in is biosafety levels. Like I said, I'm trying to cover a lot of stuff because the health and safety is a big subject. So I just want people to think about things when they're doing their evidence of, different types of evidence that they could use. So biosafety levels, there are 4 different levels. So level 1 is the lowest of the 4, and it applies to laboratory settings in which personnel work with low-risk microbes that pose little to no threat of infection in healthy adults. So, for example, you've got things like E. coli, which are just basic bog standard bacteria. Then you've got level 2, which covers laboratories that work with agents associated with human diseases, which are pathogenic or infectious organisms. So these will include things like HIV and Staph aureus infections. Then we've got level 3. So common examples of microbes which are found in level 3 labs include yellow fever, West Nile virus, and TB. Microbes found in level 3 settings are really serious, and so the work is often strictly controlled and registered through government agencies, and lab personnel are also required to have medical surveillance. They may be the ones, like I said earlier, they may need extra immunisations because of the work that they're doing. And then at the other end, we've got biosafety level 4. So level 4 labs are quite rare. There aren't really that many of them across the globe. And these deal with things such as Ebola virus, which, as you know, is a really nasty virus. Okay, so looking at some hazard warning symbols now. So within the workplace, we have all different types of symbols. So we have the general ones, which are obviously toxic, irritants, harmful, hazardous to the environment, radiation, and toxic and oxidizing agents. I'm just going to go through some of the different types of warning symbols now, because they're not all on yellow backgrounds. They're just the ones that we have common in the lab. So I did find these little posters on the Oxford University website, which were quite good. I have referenced them all, everything in the back, if anyone wants to have a look on the website anyway. So yellow, green, blue, red, any idea what's being said? So prohibition signs convey actions or behaviours that are not allowed in a particular area or under specific circumstances. Red's been chosen because it's a colour that's synonymous with danger. And so these signs often feature a red circle with a diagonal line through a black symbol or image. They can be accompanied by supplementary text, and that reinforces the action which is forbidden. So examples include no smoking, no admittance, no cycling, no photography. So pretty self-explanatory. Okay, so then we've got the yellow warning signs. So these are the ones that are quite common around the lab. So these alert individuals to potential hazards, dangers, or unsafe conditions in a specific area or circumstance. If you spot a warning sign, you should exercise caution and take the necessary precautions, to prevent accidents or injuries. Warning signs often feature a black triangle on a yellow background, and there's a standardized black pictogram. They're used because yellow is quite an eye-catching colour, and it's often associated with caution. So again, thinking back to, things, traffic lights amber, which is a yellowy colour, be prepared to move off from stationary. So yeah, it's often associated with caution. Its common warning safety signs include slippery surface, biological hazard, irritants, oxidizing agents, toxic, harmful to the environment. They're the ones that you always see on your chemicals and things in the lab environment. So then we've got red, yellow, green and blue. What am I supposed to do? So mandatory safety signs convey specific instructions or actions that you must follow. They emphasize and enforce any rules, regulations or protocols which are necessary to maintain safety in a particular environment. They often feature a white symbol on a blue circular background. Blue is not really seen as a threatening colour, but it's quite attractive to the eye. So many people now associate it with instruction because of the warning signs. So like you can see there on the example, like you must wear goggles, it's mandatory to wear gloves. So again, you may see those around the lab as well. And then we've got emergency signs, which are on a green background. So emergency safety signs, otherwise known as safe condition or first aid signs, provide you with critical information during emergency situations. So green is seen as a welcoming colour and one that symbolises safety. So the signs are designed to be highly visible and easily understood, even in high stress or low visibility situations or conditions. So things like with fire escapes, again, they're green. Of an evening, like if you're leaving the lab at night and it's quite late and it's dark, you'll find that the symbols are lit up as well to make it easy to see them in case there was a fire, for people who are working late. They're typically either first aid or emergency escape signs, and they indicate a safe place or a safe route to take. They also help to identify safety equipment and emergency procedures, which can be vital in saving lives and minimising harm during emergencies. In addition to emergency exit and first aid signs, other ones include emergency telephone. You used to see those on the motorway before smartphones come out, which I'm showing my age now. You used to have little boxes dotted along the hard shoulder that you could stop with if you broke down, you could use the telephones in them. Also evacuation assembly points, heart defibrillators and eye wash stations. They're other common ones in the lab as well. So that is the end of my presentation. I have put references in the, at the end of it. This was, I'll see if I can get this up actually. No, it's not working. It didn't last time either when I tried this. It's a little YouTube video which was on the Oxford University site, and it's quite useful. The health and safety manager is actually walking around pointing out different safety symbols around the university. So it just shows like the different settings that you may find them in. Oops, sorry. The one underneath is a safety sign quiz. So for those of you who are looking for evidence, you could use that potentially. You could print it off, do the quiz and ask your training lead to mark it for you. And you could use that as a piece of evidence as long as you annotate it and do like a reflective piece with it as well. So yeah, they're just at the end. I've also put at the end of the presentation lots of references that I've used in doing this presentation. So for example, the Green Book, that was off the government website, that adds a lot about immunisation of healthcare and lab staff. There was some stuff about exposure limits. I've only briefly mentioned stuff, but there's a lot more that you can go in and read. So if you want to have a look on there, we can send you a copy of the presentation if you want, so it's got all the references on. There's a lot of useful stuff, especially when you're trying to complete this module as well. So has anyone got any questions?
I think a few are just typing there, Fran.
Right, just bear with me a second.